Ready?
I'm ready. My name is Sara Cox. My diagnosis is stage 4 lung cancer. I noticed that I had lymph nodes, a couple of lymph nodes over my collarbone, and went to regular doctors several times, and they just seemed to think I had seasonal allergies. And something told me that I should check into it. So I went to an ENT, and he started doing some tests and determined that I had lung cancer. And we went from there, moving me from one doctor to another until I got to Dr. Saylors, who is the doctor who has treated me. Dr. Saylors came highly recommended by the pulmonologist who had told me what type of cancer I had. And Dr. Saylors knew exactly what I had and exactly what type of treatment has been successful for this type of cancer, which turned out to be a combination of chemotherapy and immunotherapy. Charleston Oncology actually runs like a well-oiled machine. Every department that I see here is professional, they're friendly, they know you by name, they do their jobs very well, and you don't waste any time in any department. You don't have to wait around. They put the quality of your life ahead of anything. Even though you need a certain amount of treatment, they also know that it's important that you have a good quality of life while you're doing that. When you get a stage 4 cancer diagnosis, you're terrified. You just want to get the ball rolling. You absolutely want to get that treatment started as soon as possible. I'm pretty sure it was a Monday that I saw Dr. Saylors, and on Thursday of that week, I was having a port put in, and 3 days later, I had my first chemo treatment. You have treatment every 3 weeks, and you don't have your first scans for 12 weeks or 3 months. The very first scans that I had were absolutely clear. All of my scans since my very first treatment have been clear, and they call it no evidence of disease. It's amazing. I had 2 parents die of this cancer many years ago. It was a death sentence. There was nothing that could really be done when they had it. But here today, I sit with no evidence of disease, and I play golf on a regular basis. I walk 4 miles a day. I spend time with my pets and with my grandchildren, and I live a very active life. But the most positive part of that is the fact that you spend your day in a normal fashion and you don't think about having cancer.